Let's keep describing the pectoral girdle. Second bone, the scapula. Isn't it cute? It's a little triangle. Where is located? It's located in the posterior, lateral, and superior aspect of the pectoral region, the thoracic region in your thorax, posterior to that. Okay, it is like a triangle, and like in any triangle, we're going to describe a superior border, then the lateral border. Okay, and the lateral border is, you know, that it's this one and not this one because it's the one located on the same side of these processes and this oval cavity. Okay, so superior border, lateral border, medial border, which is also called the vertebral border because it faces to the vertebral column. Let me see. See? And this one, the lateral, is also called the axillary border because it faces the axillary region or your armpit. Any triangle has three angles too. So we're going to describe, this is the superior angle, this is the inferior angle, and this is the lateral angle. The thing that in here in the lateral angle is where we're going to find, can you see this cavity? Labeled 28. See? This cavity is called the glenoid cavity. Look how shallow it is. See? This is the socket that keeps together or that articulates with the humerus, which is the bone of your arm. So it receives the head of the humerus to form the shoulder joint. But look how easy to dislocate this is, because this glenoid cavity is very shallow. This is one of the features that, or the features of the pectoral girdle that provides it with a wide range of motion to this girdle. We can move it a lot because the humerus is not firmly secure into the glenoid cavity. Okay, what else? Okay, we have the acromion that we described on the lecture. If you already covered this in the lecture, and yes, you did. Okay, so this is the acromion. You will see on this lateral side, superior to the glenoid cavity, two projections. The posterior one is the acromion, and the one that looks like a finger, see, it looks just like a finger, that's the coracoid process, which is in there. Now, see, this is an anterior view. You should have started saying that, right? This is an anterior view. And see how smooth all of these anterior aspect of the scapula is. And it's kind of concave, as you can see. So concavities in a or concave surfaces in a bone are called fossa, and this is the subscapular fossa. The subscapular fossa right here, we're going to see when we describe bone, muscles, that the subscapular muscle, part of the rotator cuff muscle, attaches right in here, in this fossa. Now, and can you see right here in the superior border, we have this notch. This is called the supra, because it's above, the suprascapular notch. And it's just a notch that let the suprascapular nerve pass through. So imagine the nerve going this. Whee! Okay? Now let's see the posterior. Yeah, the humerus articulates, the head of the humerus articulates at the glenoid cavity of the scapula. Okay, now let's see the posterior view of the scapula. Anterior view, I'm gonna turn it and see the posterior view is where you have this projection that we call the spine. And you should be able to touch it. Touch it right there. You can feel the spine of the scapula. So again, we have the superior border, the lateral, the medial border, the superior and inferior angle. Superior border, medial border, lateral border, lateral angle, superior angle, inferior angle. Okay, and there you cannot see it, but there it is. In the lateral angle, we can see the glenoid cavity right here at the lateral angle. Now, this big projection of bone that you cannot miss, this, see, is called the spine of the scapula. Isn't that easy? Spine of the scapula. And this spine, as you can see, divides the entire posterior surface into two more surfaces that are concave fossa. So it divides the posterior surface of the scapula into two fossas. One is above the spine, the other is below the spine. Supra, above, supraspinous fossa, and the other one is infraspinous fossa. Again, in here, the supraspinatus and infraspinatus muscles that are part of the rotator cuff muscle, part of the rotator cuff, insert in here or originate in here. So I'm just trying to make the link already with a skeletal muscle so you can see the importance of knowing all of these landmarks. Okay. Now, let's follow the spine of the scapula laterally. Laterally? Yes, is where the two projections are. So laterally, and you will see that ends in this broad piece of bone, and this is just your acromion, okay, that we describe also in the anterior view. So the anterior view, lateral view of the acromion, posterior view of the acromion, superior view of the acromion. See how flat it is? And you know already that the acromion, I put the clavicle away. The acromion articulates with the acromial end of the clavicle to form the acromioclavicular joint. I shouldn't have. Wait, it's here. Okay. Acromial end of the scapula, acromial end of the clavicle, I'm sorry, and this is anterior, okay, and the acromion of the scapula. Both articulate and form the acromioclavicular joint. Acromioclavicular joint. This joint allows just slight, like gliding movement, and they stabilize this the pectoral girdle. Now, anterior to that acromion, what we're going to find? The finger. See the finger? So that's the coracoid process. Coracoid process is very important because all of these projections of bones are like the muscle pulling out the bone. And as the muscle pulls out the bone, creates these projections. So the muscle that is inserted in here is called something with coracobrachialis, and also biceps brachii in there. Now, last view, the lateral view. Look at the lateral view. So what we can see in here, again, this is the lateral border. This is the inferior angle. And here in the lateral border, we can see the glenoid cavity, right? Now, open your eyes because this is little. Above and below the glenoid cavity, we're going to find these tubercles. And tubercles are, again, projections of bones, okay? Another name for that. They're round projections in here. This ridge in here, this is a tubercle. This ridge in there, that's a tubercle. Those are the supra, because it's above the glenoid cavity, supraglenoid tubercle, and that's the infraglenoid tubercle. And this is important to know because the triceps brachii originates in these two tubercles, biceps and triceps brachii. What else? Well, and you can see again the finger, the coracoid process facing anteriorly, right? and the acromion facing posteriorly. Okay, that's it, I guess, with the scapula. Oh, in here, see, I can, or we can see the acromion clavicular joint. Remember, just gliding movements in there. Now I'm going to show you, let me see if this is the last one. Yes. Before we finish this video, really fast, all of these bones in here, let's use all the resources we have. So if the right side of the brain doesn't understand it, let's talk to the left side of the brain. So let's see right in here. Well, yeah, very pretty, but I don't want to see that part. Okay. Sorry. Clavicle. Okay. Pectoral girdle. What are the two bones forming the pectoral girdle? The clavicle and the scapula. What we can see, or what can we identify on the clavicle? The sternal end and the flat acromial end. What can we identify in the anterior aspect of the scapula? The superior, the medial or vertebral border, the lateral or axillary border. This is the inferior angle, the superior angle, and the lateral angle. In here we can see, well, no, we cannot see it, but believe me that right there is the suprascapular notch. Anterior projection, coracoid process, posterior projection, the acromion. We can peek in here a little bit. Oh, no, I cannot zoom that anymore. But we can see in here the glenoid cavity holding the head of the humerus, forming the shoulder joint. Let's see posteriorly. Are you going to? Okay, that's okay. You know, sometimes they don't want to work with you, and that's fine. Okay, posterior view. The posterior aspect of the scapula, remember, is divided into by the spine of the scapula that ends in the acromion. So this is the supraspinous fossa, this is the infraspinous fossa, and in here, because I don't have a lateral view, maybe in here, I can see, okay, this is the glenoid cavity, this is the infraglenoid tubercle, and superior to that is not seen very well. That's the supraglenoid tubercle. Those are the structures that we need to know about the pectoral girdle. See you in the next video.